Good evening to our listening and viewing public, and welcome to the August 20th COVID-19 press briefing. On this evening's briefing, we will focus on two areas. We will focus on the COVID-19 story at the Dominica China Friendship Hospital and the protocols for the curfew for this weekend. Our presenters are the Chief Executive Officer at the Dominica China Friendship Hospital, Dr. Dexter James, and the Acting Deputy Chief of Police, Mr. Davidson Valerie. Our first presenter, Dr. Dexter James, will focus on the story at the Dominica China Friendship Hospital. He will speak on antigen testing, the challenges at the acute psychiatric unit, the vaccination program that will be launched next week at the hospital, challenges, and the way forward. So we welcome Dr. Dexter James.
Thank you, Madam Moderator. Pleasant good afternoon to members of the listening public. Pleasant good afternoon to persons on the social media. This afternoon, I want to share with you the experiences at the Dominica China Friendship Hospital as it relates to what I refer to as our COVID story. You'll recall on August the 5th, I presented some information as it relates to how the management of the hospital was dealing with the COVID situation at the facility. This afternoon, I want to share with you the results of our antigen testing program, the challenges we're currently experiencing at the acute psychiatry unit. I would share with you how are we preparing to manage the unlikely event of a surge. We're hoping to launch our staff vaccination drive next week, and I will update you on what that drive will entail. Some of the challenges we've encountered and the way forward. Immediately upon the pronouncement by our Honorable Prime Minister on the state of emergency, the management at the Queen Elizabeth at the Dominica China Friendship Hospital automatically went into an emergency state. We took some immediate actions, which included cancellation of elective surgeries. We had to cancel all outpatient services. Visitation was restricted. We indicated that only urgencies and emergencies should present to our accident and emergency department. And so those were some of the early initiatives that we took. In an effort to assess the safety of the hospital environment, we embarked on a comprehensive antigen testing program to look at what was the status of the various constituents that we serve. We did a staff testing initiative with all our staffers under the acronym called Know Your Status. We did 100% testing of all patients coming through the accident and emergency department. And we also did 100% testing of all inpatients over the period August 10th to the 12th. The results are as follows. We tested some 490 members of staff, and of those 490 staff members tested, 475 came back with negative antigens, and 15 came back with positive antigens. So in terms of the antigen testing regime, 97% of the staff tested came back negative, and only 3% came back positive with the antigen testing. In terms of the vaccination status, because what we did as well was we obtained information on the vaccination status of our staff members. And what this data reveal, of the 177 staff members who tested, 58% of them came back as unvaccinated, and 38% were partially vaccinated, and 4% unvaccinated. Sorry, let me just refute the data again. The vaccination status of staff revealed the following. We had 38% have been fully vaccinated, and 4% have been partially vaccinated, and 56% have not been vaccinated. Okay, this is what the data has shown us. For those staff members who had positive antigens, 73% of them were unvaccinated, and 7% were partially vaccinated. We further went on to do 100% testing of all our inpatients during the period August 10 to the 12th. 142 patients were tested, and these were patients who were at the ward at the time, and 127 of them came back with negative antigens, and 15 of them came back with, or 11% with positive antigens. In keeping with, of course, the protocols established by the Ministry of Health, these 15 patients were cohorted and managed outside of the entire care environment. Interestingly, when we looked at the 15 patients who came back with positive antigen tests, 87% of these cases were unvaccinated. 87% of them were unvaccinated. And I mean 14% had full vaccinations. We then did an analysis by looking at our direct patient care givers, and these would be like our medical doctors, our nurses, our orderlies, and our ward aides, because these are the frontline workers who will be directly involved in patient care. And what the analysis revealed was that 63% of our medical doctors had been fully vaccinated. 63% have been fully vaccinated. In terms of nursing and nursing staff, only 27% of them have been vaccinated. And this is 27% of those who came to get tested during the Know Your Status program. 40% for ward aides, and a mere 45% for the orderlies. We then looked at the vaccine uptake within critical departments. And these departments, we said, look, these are fairly high-risk departments, places like our accident and emergency department, or ICUs, or neonatal units, dialysis units, oncology units. These are units where you have patients whose immune systems are very weak and compromised. And we said, let's look and see what the vaccination status of our caregivers showed for these particular units. At the accident and emergency department, only about 35% of staff were fully vaccinated, and about 65% were unvaccinated. That's at the accident and emergency department. In our ICUs, only 44% of staff were vaccinated, and a mere 6.2% partially vaccinated, and almost 50% unvaccinated. The dialysis unit, only 14% were fully vaccinated, and 78.5% are partially vaccinated. We then looked at our accident emergency department. We said, listen, let us ensure that all the patients coming to our accident emergency department, if they have to be admitted, we know what the status was before admissions. During the period, we started that program on August 11th, and as of yesterday, August 19th, we've seen 304 patients coming through the accident emergency department. Of the 304 that came through, 91% of them, of those patients, tested negative, and about 8.7% of them were positive. And that's about 28 patients over the period of time came back positive. Looking at the entire vaccination status of the 304 patients, we saw 208 of them were unvaccinated, almost 69%, and 96 of them were vaccinated. Interestingly, of the 28 that tested positive, 23 of them were unvaccinated. So the two things that we see happening here, there's this correlation between persons presenting with positive antigens and the vaccination status. These three strategies were very important to us because, as you would well imagine, had we not picked up those 28 patients coming through the emergency room, or identifying persons on our wards and understanding the vaccination status of the antigen status of our staff, these persons would have been, patients may have been admitted to the open wards and infected the entire population. So this strategy, in a sense, allowed us to identify the cohort that was at risk to the environment of care, isolate them, and manage them outside the care setting. So what were the findings generally from this antigen testing program? We saw a high level of responsibility of staff to the Know Your Status antigen testing program. The 100% testing at the Accident and Emergency Department mitigated the potential spread of the virus within the hospital. The 100% testing of all inpatients allowed us to isolate patients soonest and therefore again mitigate the transmission within our wards. We have identified through contact tracing that the source of our staff positives, those staff members who came back with positive antigen, were community-based. In other words, the staff did not contract the virus within the hospital setting. And our contact tracing methodology allowed us to pick up the contacts for further management. The vaccination status of staff ranges from 38.6% for staff who were fully vaccinated to 42.3% to staff that were partially vaccinated. The level of vaccination by staff, we deem it to be low to moderate. There seemed to be a high correlation between a positive antigen test result and unvaccinated persons. This is while it's highly unscientific, but the three cohorts that we tested, there is that correlation between your positivity or your antigen result that is positive and your vaccination status. Most of those patients who came back with a positive antigen were unvaccinated. I assure the public that the hospital environment continues to be very safe for carrying out patient care, and then there's no need to panic as it relates to providing safe and good quality care at the Dominica China Friendship Hospital. The next area I'd like to represent this afternoon is the challenges we have at the acute psychiatry unit. That facility has a capacity of 33 beds. Its current occupancy level is 23 or about 70%. Recently, we've been having some challenges relating to inpatients coming up with reflecting a positive antigen status. Of the 14 patients tested 2 days ago, 8 patients tested positive. Of the 7 patients tested on the chronic beds, 6 patients returned a positive antigen test. Additionally, 4 staff are tested positive and are in quarantine. Having looked at the data and the likelihood that more of those inpatients would come up with positive antigens, management has declared the acute psychiatry unit as a COVID isolation center until all patients are retested over the next 12 to 14 days. In short, the entire APU right now is on lockdown, and as we begin to test all the other patients who are currently asymptomatic, we will then cohort them as one group and continue to test them 12 to 14 days in accordance with the Ministry of Health's protocol for testing. Management has looked at the challenges that we currently face and have begun to put arrangements in place for the unlikely event of a surge. There are a number of strategies that we implemented over the last week and a half, 2 weeks. We had to consolidate some wards where possible. We have relocated some inpatients to other inpatient settings. We've now converted the outpatients department into a full-fledged ward. And that what it has done is freed up some of the open wards for us to be able to manage critically ill patients. We have repurposed Glover Ward, which now has 16 beds and 4 ICUs as a new isolation unit. This unit has very specific protocols for admissions because we don't want it to be filled up with asymptomatic, very mild patients presented with mild condition. This is an acute facility for severely ill patients that are symptomatic, that require some form of ventilation. We've also had to open up our dialysis isolation unit because we had about 2 patients two dialysis patients who returned a COVID positive result. So this is essentially our preparation for managing the surge. Next week, we will be launching our vaccination drive at the Dominica China Friendship Hospital. This vaccination drive will be launched in partnership with the Dominica Medical Association, the Dominica Nursing Association, the Dominica Public Workers Union, and PAHO WHO. Senior nurses and doctors will be trained to administer vaccines, and they would lead the program at the hospital. The program provides for improved on-site access so that staff members don't have to go anywhere to get the vaccines. They can get the vaccines right at the hospital. We will also make the vaccines available to unvaccinated patients who present to our accident and emergency department and all inpatients. So in short, the entire cohort of patient activity and staff activity at the hospital, we will provide the opportunity for vaccination. Our target is to vaccinate at least 65% of our staff in this first wave of vaccination drive at the hospital. Has this exercise been without its normal challenges? It has. But the management team and I and senior staff at the hospital have been working tirelessly in working through the challenges that present to us on a daily basis. Manpower is one of the areas that we face. By doing more and more testing in the accident and emergency department, placed a severe burden on our staffing resources in that department. We've reached out to the Dominica Medical Association, and they have provided us with some doctors who have agreed to volunteer their time at the department. Some doctors in the private sector have consented to work on a sessional arrangement, and we are about finalizing those arrangements as we speak. The bed availability, as I mentioned earlier on, we've repurposed some facilities as acute beds, and that is well on the way in progress. From a patient safety standpoint, we are now testing. We are not only testing all the patients coming through the accident and emergency department, but for those who are admitted, we also now testing them 5 days after admissions. Just in case that the virus is incubating, we can pick up those patients very, very early. So we have a fairly aggressive testing regime to make sure that we continue to provide a very safe environment for the practice of medicine at the Dominica China Friendship Hospital. The patient transportation is a challenge. The number of patients who present to our accident emergency department have been deemed COVID positive, antigen positive, require transportation either to their homes or to the Portsmouth facilities. And we've had to provide transportation for them in some cases. We're asking persons who present to the A&E department and have a positive status to please make your arrangements for transportation, because when we utilize our limited resources to transport you to your homes, then it constrains our ability to be able to provide other types of services to members of the public. Let me close by saying that I really want to thank all healthcare workers for this labor of love. It has indeed been a very challenging time for us, but when times are tough, healthcare workers know how to rise to the occasion. So I really want to reach out to them and support them in whichever way we can. At the Dominica China Friendship Hospital, we've reached out to the Dominica evangelical churches. I am meeting with them next week. We're going to be discussing how can we provide emotional support to our caregivers as part of a support program for all our employees. I'm looking forward towards that program. So in closing, my remark is just simply get vaccinated. Get vaccinated. Vaccination provides a measure of protection for you against the virus. It allows us to, it prevents or reduces the transmission of the virus to yourself, and therefore reduce the exposure of you to the particular risk. The data that we have, as unscientific as it is, shows this correlation between patients who are tested positive and the vaccination status. So we're making a special plea to the public, to our healthcare workers, get vaccinated. The hospital will continue to provide services to patients on chemotherapy and on dialysis treatments. Patients are requested to present for treatments on time. Patients are requested to present for treatments on time. We're making a plea again to the public, avoid coming to the accident and emergency department unless there's an urgent, life-threatening situation. Avoid coming to the accident and emergency department unless there's an urgent or life-threatening condition. And finally, patients receiving care at the accident and emergency department must make their own arrangements for transportation after care is provided. Patients presenting for care at the accident and emergency department must make their own arrangements for transportation after care is provided. Members of the listening public and persons on the social media, I thank you for giving me this opportunity to share with you openly and honestly what the state of play is at the Dominica China Friendship Hospital. And we ask you to partner us in continuing to make the hospital a safe place for us to practice medicine and a safe place to provide care to the population. I thank you.
We want to thank Dr. James for such a detailed presentation. And at this point, we want to welcome our second presenter, the Acting Chief of Police, the Acting Deputy Chief of Police, Mr. Davidson Valerie. He will speak on the curfew protocols for this weekend. He will also urge the public to engage in our fight against the illegal entry into our country, which in turn will assist with our fight against the COVID-19. He will also encourage persons to conform to the protocols at the quarantine and safe in nature facility. I want to welcome Mr. Davidson Valerie.
Chief Executive Officer, Dominica China Friendship Hospital, Dr. Dexter James. Moderator, Ms. Vernell Ole, Communications Officer in the Ministry of Governance. Members of the listening public, members of the media, good evening. The state of emergency imposed throughout Dominica and the curfew order, as you may be aware, have been extended till Monday, 23 August 2021. Under the curfew order, a person shall not be out in a public place between 6 p.m. on Friday, August 20, and 5 a.m. on Monday, August 23, 2021. All places of religious instruction or worship shall remain closed. Bars, salons, barbershops shall remain closed. All business establishments shall remain closed throughout the weekend. A person seeking urgent medical attention, an essential worker, a person who has a written permit from the Commissioner of Police, a person accessing COVID-19 testing, and a person traveling to and from the airport or seaport are the only ones permitted to be exempted. And I will say that again. If we look at the persons who are permitted to be exempted, we will see that the law refers to a person providing essential service. So an essential worker, a person who has a written permit from the Commissioner of Police, a person seeking urgent medical care, a person traveling to and from an airport or seaport. Everyone else is being encouraged to remain at home, including essential workers who are not required to be at work. Petrol stations shall remain open from 6 a.m. to 4 p.m. on Saturday and on Sunday, the 21st and 22nd day of August 2021. However, this service is available for essential services and workers. No one must be on the streets or street corners or in a public place. An appeal is being made to you to adhere to the protocols and the measures in place to prevent the further spread of COVID-19 in Dominica. Additionally, a number of people have been released by the health authorities. These individuals have been issued with a wristband and are warned to remain indoors. Let me warn that if you are found out of your home in violation to the instructions of the health authorities, you will be charged. Persons who are in quarantine at the government quarantine and are at safe in nature facilities, you are to conduct yourselves in an orderly manner, and you must remain indoors. You must remain in your assigned or designated location. You must only leave when permitted to do so by the health authority. Section 7 of the Quarantine Act number 4001 of the revised laws of Dominica of 2017 makes it an offense for you to violate the instructions of or any conditions imposed by the health officer. You will be charged and you will be liable to pay $10,000 and to imprisonment for 6 months once convicted. The police have preferred 30 charges for breaches of the curfew order and will continue to prefer charges against anyone found to be in violation of the curfew order. The Commonwealth of Dominica Police Force continues its operations on sea and on land. I must report that we have made many successes. So far this year, 2021, 31 persons have been convicted for illegal entry in Dominica. I am taking this opportunity to warn persons against entering and leaving the island illegally. I want to thank the many people who have provided information. I want to encourage citizens to continue to partner with the police to clamp down on illegal activities. As I close, let me remind you that if you are not permitted by law or exempted by the chief of police to be out, then you must remain indoors and avoid all unnecessary unpleasantness. Again, I urge everyone to please obey the curfew order and the measures in place to prevent the spread of COVID in Dominica. Finally, I wish to inform that 10 of our officers were infected with the COVID-19 virus, and they are all recuperating satisfactorily at their respective locations. This means that no one is immune to this virus. Let us work together to reduce the number of cases and prevent the further spread of COVID-19 in Dominica. Together we can. Together we must. I thank you.
I want to thank everyone for tuning in to this evening's press briefing, and especially our two presenters, Mr. Davidson Valerie and Dr. Dexter James. But before we close this evening's briefing, I want to make a quick mention to a new social media campaign that we have officially launched at the Ministry of Health from today. We are inviting persons to take part in a social media campaign where you are asked to submit videos which are no longer than a minute, promoting the vaccine, promoting testing, promoting the health protocols and policies implemented by the Ministry of Health and by extension the government of Dominica. Please look out for an interesting cash prize. Please do have a pleasant evening. Hi, are you looking to be part of the COVID-19 battle? Are you tech savvy, own a mobile device and creative? If this sounds like you, here's your chance to win an attractive cash prize from the Ministry of Health, Wellness and New Health Investment in our COVID-19 short video competition. Simply create a video up to 1 minute long, encouraging your peers to get tested, get vaccinated, or just to promote the health and safety protocols. All video entries should be submitted to the Ministry of Health at our email address at healthp3@gmail.com and will consequently be uploaded to the Ministry's Facebook page. And then the competition begins. The video with the most likes and shares will win. Visit the Ministry of Health's Facebook page for further details. Remember, we are all in this together.